Good afternoon. Today we're going to be going over the second part of OMM review. We're going to be talking about evaluating the patient head and neck section. So I'm going to go through the different steps. I want you guys to realize this is the preferential method that I chose and I felt like works best, at least for me. So I hope this video, you find this video very helpful, and you can always choose your own method as long as you go over every single steps that's required by the OMM review sheet. Thank you. Hi, my name is Adeleke, and I'll be here today evaluating you. So what brought you in here today?
Just sinus pain.
Okay, patient has sinus pain. Then I'm going to evaluate the patient to see for any somatic dysfunctions. First, I want the patient to bend his neck down. Thank you. And I'm going to passively flex the head of the patient. I want you to extend. Great. Now I'm going to extend. The patient does an active motion. I want you to rotate to the other side. I'm going to passively rotate to this side also. Excellent. Good job. I want you to side bend your neck to the other side. Good. To this side also. Great. So the patient has really good range of motion. And now I'm going to check for his cervicals. So now I'm going to palpate to see if the patient has any cervical dysfunction starting from about C2 to C7. Does it hurt on the right? Okay. How about the left? Okay. How about the right? On the left? Okay. On the right? No? On the left? Good. All right. Now I'm going to check the patient's sinuses. We're going to start with the frontal sinus. So I'm going to palpate and press down. Does that hurt? Yeah. Okay, good. How about this? So I'm palpating on the maxillary sinus right now. Now I'm going to feel for the patient's lymph nodes to see for any swollen lymph nodes or lymphadenopathy. Start for posterior auricular lymph nodes, light palpation to deep palpation, then anterior lymph nodes, the pre-auricular lymph nodes. Then I'm going to go submaxillary to feel for any light to deep. See, thin. Then I'm going to go submental to feel for any lymph nodes also. Then we're going to take a look at the sternocleidomastoid muscle, and we're going to go posterior to it. That's where your posterior lymph nodes, cervical lymph nodes are going to be. So light palpation to deep to see if there's anything swelling. Also on the other side, bilaterally. Now I'm going to palpate the anterior lymph nodes also. See if he has any swollen lymph nodes. And I'm going to palpate his supraclavicular lymph nodes. Alright? Great. Now I'm going to continue my physical exam by examining the patient's ear. And now, turn this on. Great. Now, I'll pull the patient's pinner superiorly and posteriorly to straighten the external auditory meatus and place the otoscope right in there and look right in there. Good. This patient's great. Same thing here. Straighten it. Good. This patient is doing great. Now we're going to check the nasal sinuses. So I want you to lift your nose up. Good. All clear. Open your mouth wide. Say ah. Good. The patient doesn't. You can basically look at the anterior and posterior pillars. You can see the uvula. Check for the tonsils. See if they're swollen or not. I'll check for the pharyngeal tonsils also to see any swollen lymph nodes. So we've basically run through a quick head and neck for the patient. Now I'm going to go ahead and check this thoracics. So I want you to put your arms forward, and I want you to bend forward. So the patient's actively bending forward, and I'm going to passively bend the patient. I want you to extend your hand backwards. Now I'm going to extend passively. I want you to rotate to that side for me, please. Thank you. And to this side. Thank you. I want you to side bend. Great. And to the other side. Excellent. Now I'm going to check the patient's cervical of the thoracic vertebrae. So can you please? Thank you. So I'm going to start by palpating. Does it hurt in the right or the left? Good. All right. The right or the left? Does it hurt?
Right.
Okay. Does it hurt?
Still right.
Okay. Patients have a lot of somatic dysfunction on the right.
Yes.
That's on the left? Okay. So I'm going one vertebrae to another, checking for any somatic dysfunction in the back. All right, good. Now that I've checked that, on page 4. Now, I have to. Now we're gonna go over and move down. Since I've checked this thoracic thoracic vertebrae, I'm now gonna listen to his heart and his lungs. So I'm just gonna listen to your heart, Mr. Taha, and this should be nice and easy. Okay?
It's not gonna hurt.
No, it's not going to hurt. So I'm going to place my stethoscope in the second intercostal space, which is between the second and the third rib, and I'm going to be listening to the S2 sounds. Now I'm going to place also on the other side, and now I'm going to be listening to the pulmonary sounds for S2. Good. Now, I'm going to listen to the tricuspids, which are mid-sternal. And I'm now going to listen to his mitral, which is on the fourth intercostal, right mid-clavicular. Great. Seems like his heart is clear. I'm gonna listen to his. Can you move to the other side so I can listen to your heart, lungs? So I'm not gonna listen to his lungs. Now, what I'm actually listening to is something called the triangle auscultation. This is the patient's medial border of the scapular, and what actually happens is like a triangle. And what you notice is the inferior angle of the scapular. And you have the medial border of the scapular. The latissimus dorsi is going to be the base of the triangular auscultation. And his trapezius, which is coming basically medially, right around here down to the center. Remember we went over the origins and insertions of the trapezius muscle. So basically that's where exactly you can listen to lung sound. So I'm going to listen to that, and I'm also going to place it right under his ribs also to listen, because when the patient inspires, the lungs goes from T8 to T10, and basically because of the expansion of the lungs. So that's what I'm going to be doing right now. I'm going to listen bilaterally and hear for any wheezing, any rills, any sounds, and we'll check in a minute. So take a deep breath. Breathe out. Take a deep breath. And out. Breathe in. Clear. Breathe in. And out. So the patient's lungs are clear, and we're going to move on to the other side of the examination. I'm going to check for his ribs. Can you breathe in for me? So I'm checking for rib 1. And breathe in again. Now I'm checking for ribs 2. I want you to lay on your back for me, Mr. Taha, and this way. And just give me 1 second. All right. So now I'm going to be checking for the patient's rib function, and just to check for the upper ribs. Rib 3. Breathe. Take a deep breath in for me. And out. Great. Excellent. Now I'm going to check for his clavicles. So I'm going to palpate his clavicles. And now I'm going to place my hand over to stabilize the clavicle. And I'm going to internally rotate and externally rotate the clavicle just to check for range of motion of the patient. There you go. All right. The patient has good range of motion. And now I'm going to place my hand on the sternum. And basically I'm placing my hand on the manubrium of the sternum and checking for any slight movement. So I'm going to try to extend and flex the Then the sternum, a little side bending to the side. Good. I'm going to just quickly check for abduction of the clavicle and adduction. Extension and flexion. And that's it. I'm done. You can stand up. And we follow with treatment.
Okay.
And I'm going to call the nurse so they can take care of you.
Thank
All right?
you.
Thank you.
Thank you, doctor.
You're welcome.